Hi, I'm Dr. McGowan, triple board certified physician, obesity medicine specialist, and medical director of TrueU Weight Loss. Today, we're going to discuss the key differences between two weight loss procedures, the endoscopic sleeve gastroplasty, or ESG, and the vertical sleeve gastrectomy, or VSG, also known as a surgical sleeve or sleeve gastrectomy. So this is such a common question that I hear from patients, and it's really important to understand the similarities and the differences so that you can make an informed decision about which procedure might be right for you. Now please note, I'm a gastroenterologist who specializes in ESG, and I've performed over 2,000 ESG procedures in the past 5 years. I'm not a surgeon, and I do not perform surgical sleeves. Okay, now key point number one, neither procedure is universally better than the other. Each has its benefits and its limitations, and ultimately this is about understanding your options. The great news is that there are options for patients considering surgery, or those who don't want or aren't eligible for surgery. So let's dive in and take a closer look. First, the key similarity between ESG and VSG is that both of these are restrictive procedures, limiting how much food your stomach can hold, resulting in weight loss over time. Neither procedure alters absorption, so ultimately weight loss is facilitated solely by reducing food intake. Now, despite this key similarity, ESG and VSG actually differ in almost every other way, so let's take a closer look at those differences. First is the procedure method. So the vertical sleeve gastrectomy is performed with surgical tools through incisions in the abdomen, typically laparoscopically, and it involves stapling and removing about 80% of the stomach. The endoscopic sleeve, on the other hand, is non-surgical. It's performed endoscopically, which involves the use of an endoscope that's equipped with a suturing device, which enters through the mouth, so there are no external incisions made and nothing is removed. The stomach is simply folded from the inside and stitched together. So now let's talk about weight loss. So overall, the surgical sleeve leads to more weight loss owing to its more invasive nature. Specifically, the VSG leads to an average weight loss of around 25 to 30% of body weight. So that means if your starting weight is around 200 pounds, you should expect to lose approximately 60 pounds. Now with the endoscopic sleeve, the average weight loss is 17 to 20%. So for that same 200-pound patient, the average weight loss would be 40 pounds. Now keep in mind that both procedures are proven to be effective in randomized controlled trials, and both procedures are more effective, much more effective than diet and exercise alone, which only leads to around 1 to 3% weight loss. But someone having an ESG on average would expect to lose less weight than if they had a surgical sleeve, and that's really important to understand. So let's talk about risk and recovery. So ESG has a clear advantage here due to its less invasive nature. The 30-day complication rate for ESG is around 1 to 2% in all studies and as low as 0.1% in high-volume centers like ours. Now for VSG, that rate ranges from 5% to 17% in all studies, with around a 5% 30-day complication rate in the highest volume centers. The vertical sleeve has a small risk of death, 0.39%, while no published instances of death as a complication exist for ESG. In terms of recovery, most ESG patients return to work in 2 to 3 days and can resume normal physical activity as soon as they feel ready. With a surgical sleeve, the recovery is 1 to 2 weeks, with limitations on lifting for up to 6 weeks. And as for long-term risks, there are actually no proven long-term complications with ESG, primarily due to the fact that the stomach is preserved and not cut. With the vertical sleeve, there are long-term risks such as strictures and certainly acid reflux. So let's talk about reflux, since this is a really common concern. So the vertical sleeve gastrectomy is known to exacerbate or even cause the development of acid reflux in up to 1/3 of patients, while the risk with ESG is less than 2%. This is primarily due to the anatomy of each procedure. So a surgical sleeve is stapled off and it's quite tight. It's a high pressure system, and this leads food to exit rapidly, but can also cause acid to back up, causing reflux. In fact, patients with existing reflux aren't considered good candidates for the surgical sleeve. On the other hand, ESG is a low-pressure system that actually diminishes acid reflux, and therefore reflux is not a contraindication to ESG. In fact, we routinely perform ESG for patients with reflux and even hiatal hernias. All right, next, let's talk about fullness and satiety. So both ESG and VSG are restrictive procedures, but they actually work through opposite mechanisms, and this is really interesting. So with VSG, patients feel full when food rapidly leaves the stomach and hits the small intestine, while with ESG, patients feel full due to slower stomach emptying. Both are restrictive, but they have opposite mechanisms, which is really interesting. Now, in terms of hunger and appetite, the vertical sleeve gastrectomy has an advantage here, as removing the fundus, that top of the stomach, leads to a great reduction in the hunger hormone called ghrelin. ESG does not directly reduce ghrelin, but the delayed stomach emptying helps patients feel satisfied with smaller portions, but that is a key difference. Now let's talk about insurance coverage and costs. So the vertical sleeve gastrectomy is often covered by insurance if you qualify medically, while the ESG is rarely covered and is mainly self-pay at this time. Okay, so there you have it, the key similarities and differences between ESG and VSG. Now, regardless of which procedure you choose, finding a high-volume center and a highly experienced physician or surgeon is recommended. And when it comes to these highly technical procedures, experience really does matter. It's always okay to ask your doctor or surgeon how many procedures they've performed, which can help ensure that you're choosing a provider with a high level of technical expertise. Now look, ultimately, both procedures are great options. The most important thing is that you feel comfortable and confident with whatever path you choose. And keep in mind that an expert can help to assist and guide you in this decision.